Hello, everyone. I'm Emma Von Hagel with the Siouxland District Health Department, and I'm here with my coworker and the Deputy Director of Siouxland District Health Department, Tyler Brock. Today, we wanted to spend just a few minutes to talk about hantavirus.
Yeah, you may have heard of hantavirus because it has been in the news lately in primarily because of infections that have happened on a cruise ship that happen to be in the Atlantic Ocean. And in fact, some of the Americans from that ship have actually been brought back to the United States and are being quarantined in Omaha. So it's been in the news a lot lately, and we wanted to just to get a few facts out there so that we could make sure people have a little bit of an understanding about what this is.
So, kind of speaking about it, can you tell us what hantavirus is and how common is it in the US?
Yeah, so hantavirus is actually a family of viruses that cause a variety of different infections. The one we see most often here is a severe pulmonary or severe respiratory infection. Early stages are fatigue and fever, leads eventually to a cough and shortness of breath. And even in some more extreme cases, your lungs can actually fill up with fluid. It can be a very serious infection. In fact, some of the people from the cruise ship have died, unfortunately. So, again, it's something that we take very seriously. It is uncommon, but not unheard of. In the last 25 years or so, there's been a total of 900 cases of hantavirus reported in the United States, and that includes 12 in Iowa, which also includes one of those Iowa cases was actually this year. So again, it's an uncommon infection, but we do see it, and it can be quite serious.
Yeah. So, I mean, talking about that we do have it here in the US, how can someone become infected with it? Like, how did you get it?
The most common way for people to get hantavirus is by becoming infected through mice, rats, and rodents, so that when they when you get into an area where there's a lot of rodent urine, droppings, nesting materials, saliva, and you get in and kind of disturb those nests, that virus can become aerosolized, and then we breathe it in, and that's how we get it. So again, and usually hantavirus is not spread person to person. However, there is one virus that's a part of this family called the Andes virus that can be spread person to person. It's limited, it needs fairly close contact, so it's not something that, like we would relate to influenza or COVID-19, where you can become infected just by having microscopic aerosolized particles. That's not what this is. This takes much more close contact, but it is possible to be passed person to person. Fortunately, the rodents that carry this Andes virus version are not found in the United States. So that would not be a big risk for us. However, again, with the seriousness of the illness, we want to make sure to take it as seriously as we can.
Yeah, especially since, like you said, there's different strains of the virus. We have some of the strains in the US, there's different strains around different countries. It's not uncommon, it's not unheard of. But since we know it's in the US, how can we protect ourselves against it? And how concerned should we be about this cruise ship?
Yeah, so first of all, the first things that you do is you want to keep mice and rats out of your house, out of your living environment, number one. Number two, if you do find yourself having to clean up an area, maybe it's a barn or something like that, where you know that there's been rodent activity, just protect yourself by wearing a face mask, maybe some eye protection gloves to keep that virus from being breathed in. Again, it's not uncommon, but it doesn't happen very often. Now, in terms of how concerned do we need to be over this outbreak on this cruise ship, anytime we have a serious virus, we're going to take it seriously. Okay, but this is not a virus that causes outbreaks very often. Okay, and so while we have some concern, and those folks are being quarantined to see if they develop any symptoms and try to prevent them from spreading it to anybody else. It is not something that's likely to cause any kind of outbreak on any kind of a large scale. So again, we'll have a healthy concern because of the nature of the virus, but not be overly concerned that what happened on this cruise ship is going to somehow lead to some kind of large scale outbreak, pandemic type issue.
Yeah. I feel like kind of with any virus or any illness is if someone starts having symptoms that probably shouldn't share bodily fluids with because you're gonna get it anyway. And I feel like is kind of what this is with the antivirus.
Yeah, and again, for the most part, for the most part, the strains of hantavirus that we see in the United States are not really passed person to person. So the average encounter, yeah, we've got a lot of barns, we got a lot of rodents and things like that in Iowa.
Midwest.
In Iowa, no question about that, but that is not the strain of the virus that we're talking about as having with this cruise ship.
Okay, well, this is all really good information. Thank you all for tuning in to learn a little more information about it. We'll do this again if needed, depends on what happens next. So thank you.
Thank you.